Who Wants to Be a Millionaire? Are you ready? All right. So you have a chance to win $1 million doll hairs, not dollars. All right, here we go. So this is a fun game that we'll play, and it's fake, but it's going to be fun. Are you ready? All right, because there's not $1 million coming your way. All right, here we go. This is a way to test you and also to be able to talk about a couple topics or some things that we haven't talked about before. All right, so let's have some fun with it. Here we go. All right, so if you're familiar with Who Wants to Be a Millionaire, then you probably know that you have an opportunity to win $1 million. Let's see. All right, what act protects volunteer first aiders from liability? Okay, is it A, the Act to Promote Good Citizenship, B, the Chase McEachern Act, C, the Good Samaritans Act, or D, the Good Galatians Act? Okay, so what I want you to do is either text me your answer or write it down on a piece of paper. Okay, my number is 519-919-9235. You can send me a text message or you can write it down on a piece of paper. All right, so what do you say? The answer is, let me go to it. Yep, the Good Samaritans Act. All right, I bet you knew that one. Here we go. What does CPR stand for? Okay, is it A, compressions per resuscitation, B, cardiopulmonary resuscitation, C, capillary pulmonary recuperation, or D, circulatory pulse resuscitation? Okay, so write down your answer. So you have some lifelines. You can phone a friend. You can call someone up and read them the questions as well and the answers and see what they say. And I'll give you a point where we can subtract 2 and have 1 right and 1 wrong answer left. So here we go. The answer is cardiopulmonary resuscitation. I bet you knew that one. All right, here we go. $300. After a child ingests a potentially deadly poison from underneath the sink, the proper responder action would be to A, induce vomiting and then call Poison Control Center, B, call 911 and then call Poison Control Center, C, call Poison Control Center first and then 911, or D, the order of medical help does not matter. What do you say? All right, final answer. Write it down or send me a text message really quickly. 519-919-9235. And the answer is, drum roll, call 911 and then call Poison Control Center. So we always want to have 911 on the way because Poison Control Center could say, please hold. And you're sitting there for 10 minutes. The ambulance could have been there by that time because we said this is a potentially deadly poison from underneath the sink. All right, here we go. What is the treatment for a complete thumb amputation? Let's see. Is it A, put the thumb back into place and splint the wrist, okay, like it were a fracture? B, we're going to apply direct pressure to control the bleeding and drive the casualty to the hospital as quickly as possible. Are we C, going to control the bleeding with direct pressure and rest, wrap the amputation in a moist dressing, bag it, and put it on ice? Or are we going to wrap the amputation in a dry, sterile dressing, bag it, and put it on ice first, then control the bleeding with direct pressure and rest? All right, what do you say? A, B, C, or D? All right, and the answer is, send me that message. The answer is C. Of course, that's what we're doing, right? Remember this finger that we wrapped up in a moist dressing? We bagged it and put on ice. All right, these questions are easy. Let's get to some hard ones. All right, here we go. A burn to the full right arm, the groin, the full right leg, and the upper chest area is what percentage of the body? So this is called the rule of nines. The rule of nines gives your head to be 9%, your arm 9%, your arm 9%, your body right here 18%, the back of the body 18%, each leg is 18. So anything that's small gets 9, anything that's large gets 18, and your groin is worth 1% of the body. Okay? So, knowing that, the rule of nines, which one is it? 46%, 36, 37, or 28%? And your palm, not including the fingers, is 1% of the body. So that's another way called the rule of the palm. Okay. Bum, bum, bum. Bum, 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 bum. All right. There's your math, and the answer is 37%. So this is one that knocks a lot of people out of the game because there's a kind of a trick. So we have our arm worth 9%. We have our full body worth 18. However, I said the upper chest area, so only 9% of the body. So your cavity can be broken down into the abdominal cavity and the upper part as well. So only 9% there. Your groin worth 1% and your full leg worth 18% would be 37%. All right, here we go. For 2,000 doll hairs, a casualty with an amputation injury displays vital signs of having a fast and weak pulse, fast and shallow breathing, cool and clammy skin. What condition is the casualty presenting? All right, I bet you know this one too. Is it hypovolemic shock, strained abdominal muscle, tetanus, virus infection, or they're malingering, they're faking? What would you say? Remember, you can phone a friend. Make sure you're texting me the answers, 519-919-9235. All right, and the answer is hypovolemic shock. So hypo means low, volemic means volume, and shock. We talked about the shock cycle, right? And so this person has a low volume shock from losing blood, and that's why they're displaying signs of shock. Amazing. All right, here we go. $4,000 after caring for a complete amputation, so it's fully chopped off. In what position should you put the conscious casualty? All right, so what position could you put them in? Could you put them in the recovery position on their side, the shock position, which would be laying on their back and elevating their legs, laying face down called prone, or laying on their back called supine? All right, what do you say? The answer is D, on their back, called supine. So you might have thought the shock position because a person is experiencing shock. However, we don't use that position anymore. That's where we laid people on their back and elevated their legs. We don't do that anymore. Okay, so we just lay them on their back because it could complicate other injuries that you might not know about by elevating their legs. All right, and here we go. This is for $8,000. So $8,000. So based on WSIB's Form 82, who must arrange and pay for ambulance transportation to the hospital? Is it A, the employer, B, the casualty, C, the surgeon, or D, the family members? Who has to pay for the ambulance? Because someone has to pay. Who has to pay for ambulance transportation to the hospital? All right, and here we go. Answer is, you might have got this one, it's the employer. So when you injured at work, the WSIB, the Workplace Safety and Insurance Board, says that Form 82 here says, you've probably seen this up on a board, definitely they have this at West. It says 1, get first aid immediately if needed, and B, the worker must tell the worker about the injury, and the employer must arrange and pay for ambulance transportation to the hospital for you. And then C, the employer must then pay the wages for that day that you missed at work. So while you're in the hospital, you're still getting paid for that day. That's pretty cool. And then the employer must report it to WSIB if it involves any lost wages, any time away from work, or any health care treatment. Okay, here we go. Next question, 16,000 doll hairs. What is used directly on the wound to absorb the blood and control the bleeding? You know this one. A, dressing, B, bandage, C, plastic, or D, a tourniquet? And the answer is A, a dressing. because dressing's like salad dressing. It goes on top of the bleed, right? All right, there we go. We're making moves. $32,000. What is the minimum number of times per year a workplace is required by WSIB to check their first aid kit? Oh yeah, you know this one. A, 4 times, B, 12 times, C, 3 times, or D, 1 time. You know this one? Send me that text message or write it down. Commit to a final answer. Final answer are in, and the answer is quarterly, 4 times per year, every season. Oh yeah, $64,000. You ready? Here we go. What 2 heart rhythms will a defibrillator shock? We talked about this yesterday. Is it A, ventricular tachycardia and atrial tachycardia? Is it B, atrial fibrillation and atrial tachycardia? Is it C, ventricular fibrillation and atrial fibrillation? Or D, ventricular fibrillation and ventricular tachycardia? And the answer is D, ventricular fibrillation and ventricular tachycardia. So you remember those rhythms? Shock advised. I'm clear. You're clear. Everyone's clear. Shock. There we go. All right. And if a casualty is not breathing, their skin color is gray, and their pulse is 37 beats per minute, what procedure should the first aider perform? A, a head-to-toe assessment. B, rescue breathing. C, start CPR. Or D, treat for shock. And the answer is, get those final answers in. They're not breathing. Their skin is gray. The answer is, we need to start CPR because they're not breathing. If someone's not breathing, that's bad. All right, here we go. 250,000, we're almost done. During a chemical burn, where can you find more information than what is on the bottle label? It's prepared by the material manufacturer or the supplier of the chemical. Are you going to check your first aid manual, the dictionary, the chemical safety rescue sheet, or the material safety data sheet? And the answer is, if you've taken WHMIS, you might know this answer. There we go, the material safety data sheet. And sometimes it's called just the safety data sheet. All right, 500,000. In a single rescue situation, what device is not recommended for use? So you may not know this one, but answers A, B, C, or D. A, a bag valve mask. B, a pocket mask. C, a defibrillator. And D, a face shield. So we can kind of rule this out. You know that D, you can use a defibrillator with lots of people, and you can use it by yourself. Okay? D, face shield, you can definitely use that by yourself. The pocket mask you can use by yourself, so the answer must be the bag valve mask. That's where you squeeze the bag. You need someone else there to help you with it. All right, the bag valve mask. And the final question, $1 million. All right, it says, if rolled in the recovery position, a casualty having a stroke in the right side of their brain should be rolled on which side of their body? So they have a stroke, blocked off blood vessel in the right side of their brain. This is for the $1 million. Well, actually, $1 million hairs. All right, what do you say? Commit to a final answer in 3, 2, 1. And the answer is, we'll be back after this commercial break. No, I'm just joking. All right, the answer is on the right side. So you're probably wondering why. So if someone's having a stroke on their right side, they're going to have left-sided symptoms, paralysis, weakness. So it's all going to be on the left side. So you don't want to roll them on their numb, weak side. You're going to roll them on their strong side, so that all their symptom side is up. So that's why we're going to roll them onto their right side. All right, congratulations. You are now a first aider. So I just want to thank you for sticking with me and through this format, and hopefully you learned a lot. Hopefully you can take some of the things you learned and be able to apply them right away to help people. And so I just wanted to encourage you that the number one reason why people don't help is because they feel like they're gonna get sued or fined or something. And so now you know the Good Samaritans Act protects you as a volunteer first aider. So I want you to get out there. I want you to help people. And if you want to take a full class, then we do teach the classes here at our building at Solid Foundation Chiropractic. Hopefully we can get into the classroom soon if this quarantine situation changes. But for now, you have some really good information to be able to take your first aid to the next level and to be able to help people. So I'm Dr. Brock Van Dyke. You can find me at bvdemergencytraining.com or at solidfoundation.ca. All right, so thanks for sticking with me and tuning in. I hope you won the $1 million hairs. Amazon will ship those out soon. Just joking. All right, so have a great day, and we'll see you later. Bye.